Hi, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about case selection for aligners versus braces, which ones are better for each one. And if you ask this question to an orthodontist, you're going to get a different answer from every single orthodontist out there. So I'm going to give you my answer, what works well in my hands. And of course, I think a lot of general dentists and also a lot of patients are confused because I do have a patient-facing Facebook group that I don't benefit from this. It's just patients keep asking me questions. So I had to put them someplace, so they had a place to ask questions, right? Where doctors can answer them or the community can answer them. But this is super common. They're like, I go to one orthodontist, they say I have to have braces. I go to another one, they say Invisalign's fine. It'll turn out just the same. What's the truth, right? What's right? Well, it depends on what works in the doctor's hands. There are doctors that are out there that are amazing with Invisalign and can get the exact same outcome on almost every case, but it takes experience. And there are doctors out there that are better with braces. So my suggestion is to find someone who's confident. And of course, a good question to ask, and I have some blogs about this, is, are you going to do this as a comprehensive case? Are you going to stick with me until it's perfect? Because what a lot of doctors do and what a lot of patients get upset about is that they'll do a light or a go or a moderate or an express case, and they won't tell the patient, and then they only get one or no refinement, and then when they don't get what they want, then they just throw their hands out and say, sorry, this is all I can do. So you want to make sure that orthodontist has experience, they're very confident they can treat your case, and that they will let you keep going with the Invisalign until you're satisfied, you and them, but most importantly, you're satisfied, and they're not going to just cut you off. And that is the question to ask. And if they are like that, then, and you can even ask. You can ask to see examples, to see cases. Just because they're a diamond or platinum provider doesn't necessarily mean they're experienced. There's a lot of shady stuff that goes on, and I always laugh when patients say, well, my doctor's platinum or whatever, or diamond. So what? Because there's a lot of shady stuff that goes on where doctors will pool with other doctors in a big group, and they'll run all the cases through their one account so that they look better than they are. That doesn't mean they have any experience. That doesn't mean they're any better. It just means that they're kind of shady. But there's plenty of orthodontists that are honestly doing all of them themselves, and that's a different story, right? So I think you would never know. You're not going to know that answer to that question. So I think it really depends on. And another good question is, what percentage of your cases are Invisalign versus braces if they're an orthodontist? That's a good question to ask too. It's pretty much impossible for a general dentist to be a diamond provider. So I don't think there's any way to get that kind of volume unless you're in a gigantic DSO where they're pooling. And again, the question is, well, who's doing my ClinCheck is a great question to ask, because a lot of these ones where they're doing pooling, someone else is doing your ClinCheck, which is your setup, your treatment plan, who's not even the doctor who's treating you. So that's a question to ask. Who is doing my ClinCheck? And can I see my ClinCheck before I approve and put any money down on this? That is an extremely important question. If they're not willing to let you see the ClinCheck before you put money down, walk away from this doctor, because that is not the right doctor for you. Because that means that they don't have confidence in what they do, in my opinion, because any orthodontist out there would say, heck yeah, you can see the ClinCheck. No problem. I have confidence in what I'm going to do. I'm going to show it to you. I'm going to explain it to you. If they're not willing to do that, do not see that doctor. And that's something I'm going to keep saying 100 times, because it does not cost any money for the doctor to do the ClinCheck. If they tell you it does cost them money, they're lying, okay? It does not. It costs nothing. So they can come in, they can do it. Yes, it takes the doctor a little bit of time, so a lot of doctors would like to have a deposit before they do it, but you know what? Orthodontists do this all the time. They'll do the ClinChecks, they'll let you see it if you ask, and then you can start the case. That way you can compare a variety of different ClinChecks, and if doctor's telling you they cannot email you the ClinCheck, they're lying. That means they either don't know how to do it or they're flat out lying, because there is a way to do it, and I have videos on how to do it. It changes all the time, but yes, you can. You can send a secure HIPAA-compliant email where the patient can view their ClinCheck. It does not cost them anything. You should be able to do that. Either come in and look at it in person. Some doctors don't feel comfortable sending it because they want to explain it to you. So I get that. But you need to be willing to come in and look at it. So be stubborn on that. And if that doctor is not being flexible about that, please go find a different doctor. But anyways, what kind of cases are better for Invisalign than braces, or what kind of cases are better for braces than Invisalign? So for me, 95% of the cases, it's all about the same, If it's a phase 1, which is kids age 6, 7, 8, I know that Invisalign does have a product. However, it's extremely overpriced, in my opinion. I'm willing to do aligners on a patient, but I may not want to do Invisalign. If you really want it, I'll do it, but I'm going to charge a lot because they charge us a lot and it's really unnecessary, in my opinion. But for teens, sure. A few cases might be easier in braces. One of them would be impacted canines, definitely a lot easier in braces. Really deep bite cases sometimes are better. Or I might use an auxiliary appliance. We might do something else first and then go into the Invisalign. Same thing for patients with crossbites. I might use an expander first and then go into Invisalign. But if you're willing to try a different appliance first, it might make the treatment take a little bit longer because we can't do them at the same time. Same thing if you have an anterior open bite or if you have a habit like a tongue thrust or a thumb sucking habit. It's going to be quicker in braces because I can do them same time. But Invisalign, sure, I'll treat you Invisalign. Let's just do the habit part first and then we'll do the Invisalign. So that's fine. Another one that's trickier in Invisalign would be an impacted second molar, any type of impaction. So impacted second molars, impacted teeth, way faster in braces than Invisalign. But if you're willing to have a few braces put on first and we fix that part, then we can finish in Invisalign. So you get what I mean. There are some cases that I think are better than in Invisalign than in braces. And a lot of those would be kind of open bite cases, assuming there's no habit or tongue thrust involved, I think is better. And other ones. Now, if the patient still has baby teeth, any baby teeth, or if the 12-year molars aren't in, sometimes I'll start Invisalign, but I'll usually say, let's wait, or we can do an expander or something else first, because if you've got a lot of baby teeth in, and I know my daughter's like the same way, she has 2 left and it's a really hard case. So we just got started. I get 5 years to do it. So I was like, man, I don't care. I'll just do a bunch of refinements on her. It doesn't bother me, but it does take a lot more time. Whereas with braces, it's not a big deal. You can just plop the brace on as the tooth comes up. So it might take a little bit longer, but in general, you can get the same outcome in the right hand. So look for the doctor who's confident, who's willing to let you see the ClinCheck. All right, thanks.